We built modern medicine to rescue us from the brink. Doctors perfected the art of curing infections, surviving trauma, and mastering acute medical emergencies. But our greatest biological threats have changed. We are no longer primarily fighting fast-acting pathogens. We are battling slow-moving chronic conditions like obesity, diabetes, and heart disease. The traditional hospital system struggles to handle these complex conditions because it treats the human body as a collection of isolated organ systems. A patient with diabetes might see an endocrinologist for hormones, a cardiologist for their heart, and a neurologist for nerve pain, trapping them in fragmented silos of care that fail to address how these systems interact. We see the results of this fragmentation in our hospital wards. They become overwhelmed treating the late-stage complications of diseases that took decades to develop. A healthcare infrastructure designed entirely to pull people out of sudden emergencies simply does not have the math or the biology on its side to manage lifelong chronic illness. When conventional medicine struggles to address a patient's lifestyle and holistic needs, those patients often strike out on their own. They look for answers in unregulated alternative therapies. This unsupervised journey carries severe risks. Patients who self-medicate can inadvertently trigger dangerous biological interactions between their prescribed pharmaceuticals and unverified supplements. Yet the demand for holistic options is massive. Surveys show that a vast majority of chronic disease patients actively want their conventional doctors to guide them through complementary therapies. We do not need to abandon the extraordinary diagnostic power of modern medicine. We need a safe, highly structured bridge to connect that medical foundation with evidence-based holistic care. The Rajiv Gupta integrated healthcare model provides exactly that bridge. It proposes a proactive, community-based upgrade to our entire healthcare architecture. The absolute non-negotiable rule of this model is that modern medicine remains the undisputed foundation for all diagnoses, patient safety, and emergency care. Once that diagnostic certainty is established, evidence-informed complementary therapies like medical nutrition, mindfulness, and movement practices are layered in to support long-term rehabilitation and disease prevention. This diagram maps how practices like yoga chemically alter disease pathways. On the left, we see clear reductions in inflammatory markers like C-reactive protein and cortisol. On the right, data tracks increases in antioxidant defense, driving positive outcomes for specific conditions like multiple sclerosis and Parkinson's disease. The Rajiv Gupta model shifts the clinical focus from suppressing isolated symptoms to actively optimizing these interconnected biological systems. But how do we actually coordinate this complex integration of modern and alternative medicine safely for millions of people? We rely on the air traffic controller of this new system, the Community Health Navigator. These cross-trained professionals act as the central coordinating node for a patient's entire health journey. To practice anticipatory medicine, navigators use continuous biometric monitoring powered by artificial intelligence. Instead of waiting for episodic hospital visits, this AI continuously tracks subtle shifts in wearable biometrics, spotting early signs of metabolic deterioration or dangerous stress spikes years before a clinical emergency happens. When the data flags a risk, the navigator safely triages the patient. Severe red flags are immediately escalated to conventional doctors, while early physiological imbalances are routed to certified community practitioners for targeted lifestyle interventions. This protocol ensures that complementary therapies are utilized strictly as powerful, proactive adjuncts and never as dangerous substitutes for essential medical care. Catching these risks early creates a massive ripple effect across the entire system. It systematically removes the crushing volume of preventable chronic disease from our hospital wards. By offloading this burden, we preserve our hospitals as elite, specialized centers dedicated entirely to acute trauma, complex surgery, and intensive interventions. This proactive care takes place in integrated community healthcare centers. In these physical spaces, clinical diagnostics and general practitioner consultations sit side by side with lifestyle clinics, nutritional education, and movement therapies. By stopping the waves of chronic disease at the community level, this integrated model effectively saves the conventional medical system from collapsing under its own weight. For the individual patient, healthcare transforms from a terrifying, episodic crisis into a continuous, empowering partnership. Navigators actively work to improve community health literacy. They ensure that patients truly understand their own bodies, how to read their biological data, and the hard clinical evidence behind every available treatment option. As a result, individuals remain physiologically resilient for much longer, drastically reducing their lifelong dependency on heavy pharmaceuticals and extended hospital stays. The true purpose of a modern healthcare system is no longer waiting to treat isolated illnesses. It is actively cultivating lifelong human resilience and flourishing, right in